Hello, I am Dr. Victor Flores from Oftalmología Humanista. Today, we will be talking about the process leading up to cataract surgery. Once the ophthalmologist has checked the eye and determined that there is a visually significant cataract for which surgery is deemed necessary, a whole process with the objective of performing this surgery starts. The first step is to perform certain very basic blood tests. During the surgery, there will be an anesthesiologist either monitoring or performing a light sedation with the objective of eliminating anxiety. For this to happen, the anesthesiologist must make sure there is nothing wrong with the overall health of the patient as to minimize the risk. In order to ascertain that, we will be ordering some very basic blood tests such as complete blood count and kidney function. Once those results are ready, the patient will bring them to our clinic. After that, we will hand out an order for a test in which we will attempt to measure the exact size of the eye. The eye in every patient has different dimensions, just like the feet or the hands. And picking the lens that we will introduce to the eye during the surgery is somewhat akin to picking a pair of shoes. We must send the patient to a special camera that measures the dimension of the eye, and based on those measurements, we can go ahead and pick the size of the lens or the power of the lens. Sometimes, based on the specific eye and its overall health, the ophthalmologist might indicate additional tests to make sure everything is okay before the surgery. Once those results have been delivered to us, we can go ahead and schedule the date for surgery. On the day of surgery, depending on the specific opinion of the ophthalmologist and anesthesiologist, a certain amount of fasting hours will be asked for. That ranges from 3 to 12, depending on the baseline conditions of the patient and its overall health. The surgery in itself tends to be a simple process for the patient because they are almost always sedated, so they don't really remember what's going on. Sometimes they remember the sound that the machine makes during the surgery, but sometimes not even that. When the patient comes back to normal conscience, they usually find themselves with a patched eye or with a clear plastic shield protecting the operated eye. After this happens, the doctor will give out specific instructions in terms of the post-op care. Thank you very much for your attention. I hope this has been helpful. Goodbye.